Counselor Brittenton, would you lead us in prayer, please?
Father, thank you for all you do for us. Thank you for this day. Thank you for the season that's upon us, Father. Help us to go through the day here, doing the business of the people. We love you, and most of all, thank you for Jesus. In Jesus' name, amen.
Barry Bakershaw,
Ani?
Mike Dobbins. Here. Keith Austin.
Here.
Charlie Buzzard.
Here.
Julia Coates. Here. Sean Crittenden.
Honey?
Joe Deere.
Aye.
Kanan Duncan.
Honey.
Rex Jordan.
Here.
Daryl Legg.
Here.
Wes Snowfire. Dora Katzkowski. Here. Mike Shambaugh.
Here.
E.O. Smith.
Here.
Denise Taylor.
Here.
Victoria Lesquez.
Ani?
We have a quorum.
Thank you, thank you. Could I entertain a motion, please, for the approval of the minutes?
Make a motion they be approved. Second.
Second, all those in favor?
Aye.
All opposed? Okay, thank you. Okay, our first report is the Claremore Service Unit. George Valier. I'm sorry. Merry Christmas, George.
Good afternoon. Merry Christmas. You have my report in your pack. Audiology this in October had saw 107 patients. Dental, we saw 887. Diabetes group had contact with 224 patients. Lab had 2,276. The outpatient pharmacy filled 30,431 prescriptions and mailed out 8,509 prescriptions. Radiology had 2,601 patient encounters. Mr. Buzzard, you had asked me last month about the top 5 reasons for being in the hospital. That was number 1, delivering babies. Number 1, delivering babies. Diabetes. Number 3, kidney, renal problems, pneumonia, and then COPD.
Well, thank you.
You bet.
Does anyone have any questions? Counselor Austin?
Yeah, George, I noticed on your revenues, it says down 14%. Is that a timing issue, or is there some trends you're seeing, or what?
That was just the first month of the year, October. It'll even back out.
Okay, but it's compared to the same period last year.
Yeah, for October of last year, it's month to month.
Okay. So it's a timing issue or
Yes.
something like that?
Yes, sir.
Anyone else have any questions? I do.
Yes.
George, on referrals, I know you only have so many dollars to work with. Could you tell us what the top diagnoses are that warrant the referrals that you have to go in order?
Every week, the PRC office, before they even look at referrals, they fund anybody that was transferred out. They pull those transfers, chemotherapy, and oncology. Those are all pulled right off the top, and depending on how big that is, those come off of our weekly budget first. There are actually some weeks that we don't have any money to go down into referrals. I don't know that there's actually a category. The docs sit down and rate those referrals by severity, and then they start paying from the most severe down to until they run out of money. Sometimes they don't get to pay any referrals, and sometimes they go down. They do get to pay a few, but it just like I said, they pay the transfers and chemotherapy and oncology first.
How often do you run out of money? Is it monthly?
No, we run on a weekly budget. And then every Tuesday, the review committee, the doctors meet, and every week is kind of compartmentalized on that weekly budget. That way, the last week of the year, we have the same amount of money as we do the first week.
Well, I appreciate you explaining that and sharing that with us. I know a lot of times people are very unhappy that they didn't get the referral or whatever, but I don't think people realize that you have to rate the severity of the issue and that you just aren't unlimited in funding.
That's true.
And I appreciate that. Yes, Counselor Austin.
However, they are unlimited in the service demand. There is no limit to how many people can walk through the door with a service need. And that's the issue, is you have no limit on request, but you have a limit of amount of money that comes in your door.
Yes, sir.
George, approximately how much money is that per week?
It, depending on what we get back from headquarters on chef money, the catastrophic money, it usually around 175 to 200,000 a week. And that fluctuates throughout the year as they work with chef cases and we get reimbursements and canceled, they balance the books.
See, I know so often, at least being at large, that I hear complaints or situations, but when they have no money, and then when you realize the severity of what you're dealing with and that they have to take precedence, I mean, it's kind of heartbreaking, some of those situations. Anyway, I really appreciate you explaining that. Any other questions today? Yes, Counselor Buzzard.
George, on the collections of dollars, do they go to the area office, or do you use them there at the Claremore service unit?
We keep that there.
You keep it there?
Yes, sir.
And how are those determined, how you use those dollars?
We put them back into services. That's how that third-party collections. That's how we funded the emergency room remodel,
Okay.
The new generator, the new chillers, anything we need there. That's what it comes out of as third party.
Can any of that be used for like contract housing?
Yes.
It can be.
Yes.
It's where you decide to put the
Yes.
money there.
Mhm.
Okay. All right. Well, I just wondered if it went there or okay. Thank you.
Anybody else? George, have a happy holiday.
Thank you. You too.
Okay, next up is Dr. Jones, Steve Jones. You're here today. Yes.
Good afternoon.
Good afternoon, and happy holidays to you, Dr. Jones.
Thank you. All right. I have a handout here I want to pass out before I'm going to talk about it right at the beginning before we get too far into the report. So one of the things on the first page of your report, we always try to acknowledge some of the things that are worthy of talking about, and I know there's a quote on there about flu clinics, but this is something I wanted to pass out and let you guys know in this time of the year when we're talking about a lot of giving and opportunities to give and things of that nature. This is just an executive summary of some of the things our staff at our clinics have done. And this is something I asked them to put together in a very short period of time, so it's not by all means an all-inclusive list. But you'll notice these are some of the things that my clinic directors have reported back that their staff has worked on, been a part of, and over 150 events in the community and over $10,000 worth of donations that they've collected as employees outside of their normal work that they do. And I just wanted to acknowledge that and give you guys a kind of a list of some of the things so you can see what we're doing in the communities other than just being a part of it and being part of our clinics. Yeah.
Wonderful.
And hats off to them because they do that on their own time. I mean, most of the time it's on their own time, and it's all worthwhile causes that they decide as employees to do.
You know, before you start your report, I want to commend you and your staff. You know, you and Brian Hell, and you had Dr. Montgomery. You were amongst the employees last Friday. That meant a lot to a lot of the employees. And I heard, you know, feedback that you were there in the audience with them. I don't know if you realize that, but that goes a long ways with our employees. I just want to commend you.
We can't always get out to all the events. You know, we try to cover the ones we can, but because of our work, you know, the stuff that we have to do, and some that's time sensitive, but we try to make efforts to at least somebody covering as many of the things as we possibly can.
Sure.
It should get. We've done a little bit of reorganization in our leadership team, so we're going to disperse some of the responsibilities out a little bit more, so we can cover a lot more and be a little more involved. And one of our goals is to get to every clinic as at least once a quarter, and be able to spend time with the employees and listen, you know, to what's going on with the boots on the ground. Something that we haven't done a lot of. Something we wanted to do, just haven't had the time. But that's a goal of ours starting the new year, is to make an effort to, as a team, go out and visit with each clinic and with the employees and see what we can do to make their lives and their jobs easier. Our job is to get rid of obstacles, so that they can work at the top of their efficiency. So we'll do that if we're out there and learning what we can do to help.
You know, we as a council need to be cognizant of that as well. You know, just to go and visit these clinics, just make an appearance, not any official visit, just go and shake hands, how are you doing, and just be amongst the employees.
All right, thank you. Looking at your report, there's a lot of the same stuff, just the same stuff we're going to point out. Our vacancy rate's at 5.3. If you look at, you can see at contract health how much was spent last year, and these financials are always a couple months behind, where our report's a month behind because of the data collection. The financials, keep in mind, are always 2 months behind. So this is at the end of September financials. This is October 1st financials. So you can see this is kind of the end of our year, so to speak. Our approval rate's at 97% on referrals. And if you flip over the next page, you can see our collections for the 2019 year. We exceeded our expectation there, with third-party revenue in the category below that, and dental services. And then on the next page, you'll see that most of our clinics, under service delivered by quarter, you can see that starting to ramp up, and we always expect that when flu season comes around in this time of year. So you can see that almost every clinic is ramping up. The only one that went down a little bit's in J. And then the other issue that we're working on, and I've been talking with Counselor Buzzard about this, is in J, on the prescriptions field that's inversely proportionate to the rest of the clinics. We found that we had a process problem, and our providers were discontinuing any refills and putting them in as new prescriptions. The patient never saw that on their end. They just got their refill, but it was going in as a new prescription each time when they would re-up their prescriptions instead of going as a refill. So it's got the reporting a little off, and we're getting that process fixed. So the patient never saw the difference. It just showed up different on the reporting. All right, some of the things I want to follow up on from the last time, from questions you guys asked, and signs for veterans and expected mothers. We have got a bid on some signs, and we have clinic, some parking areas for that, so we'll be getting that done relatively soon. Okay.
Thank you, thank you.
Stillwell project. We should be vacated out of the old clinic by the end of the month. The services, and I want to say this so everybody can, hopefully they'll play this. The departments that are moving over into the temporary buildings are medical records, contract health, behavioral health, optometry, physical therapy, public health nursing, pharmacy, and administration. We're not having to give up as much parking as we initially thought, but some of the patients may have to park a ways from the building, so we've got a side by side, a Kawasaki mule, I think it is, that's going to be given to the clinic to use to help patients get to and from the building, because that's a pretty steep walk. In some cases, we're going to have patient parking up next to the building, but the overflow parking is going to be a little ways away. So we're going to try to help with that. If a patient is just going for one of those services that I listed there, they can go directly to the temporary buildings and check in there. They don't have to go to the new clinic, the new part of the buildings, and check in, and then go back to those buildings. Now, if they have to be seen by primary care or a service that's in that building, they will have to go to the new part of the building, but they can go directly into the temporary trailers. We're going to have registration set up there so they don't have to go back and forth between the buildings if they don't have to. Okay. Let's see, the next thing I want to talk about is something that was discussed in MEC this last time. It was something that you guys started a while back, maybe a year or so ago, with the provider survey. And we had a work group that was made up of providers. No administration was on that work group. Dr. Doug Nolan led that group, and he gave a report in our open meeting at MEC the last meeting of what they found when they analyzed the data. They've made some recommendations, and I'm in the process of addressing all those recommendations. When we do, I'll get a draft out so that you guys can see our responses to those recommendations. Every single recommendation we had already looked at and we're already working on, with the exception of one or two that we're working on a solution to now. But for the most part, we already had things in place and we're working toward that. So whenever I get those responses officially together, I'll share them with the group. Okay. The new facility, this last week we opened up, I guess 2 weeks ago, we opened up women's clinic and pediatrics. This week we've opened up infectious disease and surgery clinic. That's not outpatient clinic. I mean, that's not the outpatient surgery part of it. It's just surgery clinic. So those two have opened up. Today's the first day that they've been there. Let's see here. A couple of things that we're working on right now. We're doing a time cycle study on how long it takes to get an appointment if you have a primary care provider and when you don't have a primary care provider. We're doing that, collecting that data now, and it's different at each clinic, so it's a very big project to get each clinic to do this, and then we'll compile the data, and I'll be looking at ways to improve that. The other piece that we're looking at is how long it takes, things that we're in control of, from the time a provider puts a referral in and someone goes into our contract health service. There's a point when that person is referred out to a outside provider, and we can't control that time frame. We can't control when they give us an appointment and how long it takes to get in, but we can control the piece in the middle of when the referral happens till the referral goes out. So we're looking at those different elements and the steps and what kind of time it takes to do that, and see what we can do to improve that process. I know you get a lot of questions on that, so that's something that we're looking to improve. Okay. The last thing I want to talk about a little bit is when you guys call us and ask for a request. And the reason I want to talk about that is because I wanted to say it on camera so that you guys aren't the ones having to deliver the news. So it comes straight from me. So if you call us and you have a request that has something to do with an employee, there are certain things that we can discuss and there's certain things we can't. We can discuss processes, we can discuss policies. We can't discuss specific things with that employee. Those are things that employee has a right to privacy on, and we have to follow those. So we can't discuss those things directly with anybody. So that's something that I want to be upfront about. So it may not be the answer you want to hear, but it's the answer that we can give, and we have to stick to that. If you call and ask about a patient issue, there are privacy laws that go along with patient issues, and until we can verify that we have permission from that patient to discuss that, we can't discuss those things. And it's not because we're being mean or picking on somebody or anything like that. It's just those laws we have to follow. And sometimes it's not going to be something that we can verify right at that moment. We have to take the time to do that. I don't think there's ever, since I've been here, there ever has been a situation where one of you hasn't called that we haven't got at least an answer that we're checking on it. or that we're looking into it. So I hope that is okay, and I want you to, I want people to hear that from me, and not so you don't have to be the deliverer of bad news when someone doesn't get the answer they're looking for. A couple of things that we won't do: I will never tell a provider how to practice medicine. I will never advise something that's against medical necessity. So if there's an issue where a provider has done something that maybe needs to be looked at, or there's something you want us to look at, we want to get that into our PBC program or into our patient advocacy so that we can track it. When we do an evaluation on a provider and we look at their chart reviews, we also look at any complaints that provider's received. If we see a pattern, then we're going to address it. Sometimes we may not renew a contract over that, but those are decisions that we use that for. So I just want to make sure that I'm up front with everybody and tell you that we will get an answer and we will get back with you as soon as we can, but there are some things that we just cannot discuss. And that's the end of my report. I'll be glad to answer questions.
Okay, Counselor Legg?
Yeah. So I know that we prescribe ranitidine, and you've heard that ranitidine is getting sued for different cancer-causing agents that are put in the pills. Are the prescription pills that we receive for Zantac the same ones that are being recalled and as having a carcinogen property to it?
So we have addressed that, and I'll let Dr. Montgomery, he's been at the forefront of that, address that a little more.
There has been no formal recall from the FDA of ranitidine. There have been some lots of ranitidine that have been identified as potentially being harmful. Any lots that might have involved, thus far we don't have any lots that we know of that have been recalled because of potential carcinogen.
Okay.
We've taken a proactive step, though, of trying to transition those patients that are on ranitidine to an alternative medication that works the same, called famotidine or Pepsid.
Okay.
Okay?
All right, thank you.
Counselor Vasquez?
Yes, I just had a comment.
Sure.
I would like to brag on the administrator of my Bonita clinic about the very thing you were just speaking of, and that when I've had 2 or 3 questionable or complaints from how timely he is and how professionally he handles each case and then follows up with me later, I really appreciate that. It makes our job so much easier. So
Thank you.
pass that along. Thanks, Elton.
Yeah, Elton does a great job.
Counselor Buzzard?
Yes, Dr. Jones. You spoke a little bit about the email that I got from this person about releasing medical records, electronic signatures. What he said in his email, that he had sent that to the Attorney General for a opinion. Can you address that as to why we, now I know we can't, our doctors will not or do not address the percentage of disability, but I think what he's asking is medical records, to release medical records using electronic signatures is how I understood it. Can you address why we're not doing that?
So the question comes in when you get an electronic signature, it's not an actual signature. It's
Yeah.
a typed name into a slot that says it's an electronic signature. And my understanding at this point is our AG's office is working through the legal ramifications of that and seeing what it is that we need to do either for or against it. But we don't have an answer yet. But that's the legality of it. Is that actually that person, or did someone else put a name in there? We need to be able to verify that and either accept it or not accept it. And I think that's the question at this point.
And I think in his email, he said that a lot of other agencies use it, and the HIPAA stuff was taken care of, so, okay, well, if you're working on it, that's fine, because
And I know the AG's office is working on it, so.
I know over the years, I've had a lot of people saying, well, they need to release my records to that agency, and for some reason they weren't, or they were confusing it with saying your disability is 85% or 50%. And I know our doctor's not going to do that because they're not
Right.
trained to do that, or not going to do it.
They
so.
can, a person can always go into any clinic and sign a release of information. and put where they want that information to go.
Yeah.
That's always acceptable. And if someone feels like, they need to get it sooner than what we're going to get our legal opinion back from, they're welcome to go into the clinic, sign a release of information, and that information will be sent right away.
And I think that's fine. I know we do that now, but I think what he was getting at is the electronic signature.
Yeah.
It makes it so much easier. You don't have that thick of the medical records going to them, it's all electronically. So, good, if you're checking into that, that's the work. Thank you. Thank you.
Counselor No Fire.
Dr. Jones, just want to thank you and your staff for looking into several things for me this past month. You guys always seem to get back to me in a timely manner. I really appreciate it. I have a question on do we do team building trainings with our departments from like our director heads all the way down to our intake nursing staff? Do we do those team building, or do we have anything set in place that they?
We don't have a formal process. We do have some things through HR that are available to our staff, and then there's also some directors will request some of that seminars and stuff for people to attend. But we don't have a formal process at this time. We're working on getting an educational department put together for the first time ever, and that department's going to be responsible for a variety of things. It's determining when you come on board what level of education that you need into our system. So a provider may need this level, a week-long orientation with a lot of training on our electronic health record, and then come back in a couple of weeks to go over the things you didn't know. Whereas someone as a clerk may only need 1 day or 2 days worth of educational training. So we're working on all those things as part of it. It's a new process for us, so eventually we want to get to that point where we do team building and staff training as groups, but we're not there yet.
Okay. Well, yeah, I mean, that's going to be great whenever it gets up there. I know I talked to Mr. Enlow about it. Frankie Hargis did some team building exercises. I think what ends up happening in large businesses, everybody's trying to work to a common goal, and like healthcare, it can be very frustrating at times. You're dealing with patient-provider issues where it's just difficult to get around it. At some point, someone may rub someone the wrong way, and it's not intentionally. It's the nature of trying to high demand, high volume kind of atmosphere, and I think that might help some of our employee satisfaction, just being able to go back and get together and doing some fun team building exercises. So I'm really looking forward to hopefully that. And if you need someone to reach out to, I think Frankie would be more than willing to kind of have her implement her experience and what her department dealt with whenever they went through it.
And the other thing we're working on is customer service, and that's something we work on a lot. We haven't been the best at that, but we're working to improve.
Yeah. Well, my hat's off to you guys. It's a tough line to be in, and I appreciate every single one of y'all. Thank you. Thanks a lot, Speaker.
Counselor Shambaugh.
Dr. Jones, I was advised that there is no physical therapy at Salina Clinic. I know that, maybe it was never put in there, but they're having to send all their patients to Veneta, and I talked to a person that said they're probably seeing more Salina patients than Veneta patients. And is there any, maybe, or if you're not aware of it, is there any thing in the works to possibly get Salina their own physical therapy?
I think the limiting factor there is space. We just don't have space for it. But we do have a very extensive physical therapy department here in Tahlequah with the new building. So I can see a lot of those patients being referred to that facility now, which should take a little bit of the heat off of Veneta, and also maybe take a little bit of the drive away. So
Yeah, that would be a bit of a drive from Salina to here too. That could be a problem.
And I think we have physical therapy in Muskogee also. So, I mean, we try to look at where someone is,
Yeah.
where their physical address is, and try to look, refer them to the closest facility. That's not always the most convenient facility, but again, at Salina, if you've been through that facility, it's been added on to a few times, and space is a little bit, it's a little tight.
So really, there's really nothing could be done to alleviate that just because of the space issue.
I would say at this time, probably not.
All right, thanks, sir.
Anyone else with any questions?
No.
Counselor Buzzard.
On this report, talk a little bit about rapid response? And I know at the clinic they use like code blue or code red. Is that the same thing that
Rapid response is anytime they have a patient that falls or
Okay.
anything like that, yeah.
Okay, I thought that probably was, okay.
And then they will call the rapid response team and they'll make the assessment of where it goes from there.
Sure. Okay, thanks. Thank you.
You want anyone else? Okay. Dr. Jones, first off, I want to start by thanking you for calling me back on Friday afternoon when I know you wanted to go home and enjoy your weekend. And I appreciate that. You were entitled to your time off, and I really appreciated that phone call. Thank you. I want to make a suggestion. I know we have new phone numbers, new area code. Are those being published on our website or in the Cherokee Phoenix? I mean, are we getting the word out that we have new numbers?
We're working on getting the word out. We had an issue with whenever you call from the new numbers that they came up United States on the caller ID. So a lot of people would not answer, thinking it was probably a telemarketer or spam or something of that nature. If we call it, my understanding is now, IT has been working on this. If it's a landline number, it's going to say Cherokee Nation. They have put in all the database for the mobile numbers to pick up. Currently, as of Friday, we were still saying United States. We don't have the ability to make them go in and pull that out of their database. When they upload it is when it will change, and it hasn't uploaded yet. But it's in there ready for them to upload, so at the time when they update their software, I guess, or whatever it is that they update with their towers, then it will come across as Cherokee Nation, and we should start getting rid of the issue of people not answering the phone or not calling us back when we're trying to confirm patients. As far as publishing them, I know we're working on that. We're working on it internally inside of the clinic itself so that we can call departments. So we are working on it. It's an active process as we move more departments over. It hasn't been perfect by any means, but it is a process we're working on.
Okay, I had a request to ask you to please check the new phone system on canceling appointments, that when they call, it's a continual recording of, sorry, appointment desk cannot take your call, so they're not able to call in and cancel because it's continual.
Okay, I'll look into that. We have had some issues with that, with people trying to call back. And again, we've had issues with people not even responding because they think it's a robocall. So we're working through those problems, but it hasn't been an easy problem to fix, and it takes multiple people working on it.
Okay, Counselor Schimbaugh.
Just a real quick comment. Like to, again, I do this quite often, but like to thank Mr. Kelly again, helped in a family in distress over a surgery and got things going on that, and very, very appreciative of that. They really were kind of at the end of their rope, didn't know what to do, and he came in and got them some help. So just wanted to say thank you, sir.
I wanted to ask you if in the future in your report, if you could include the top 3 diagnoses from each clinic.
Okay, and we do that occasionally. That last page rotates quarterly. We've had the prescriptions on there because it's been an issue that we've been working on. But I think it was 2 reports ago, you got the top diagnosis for every clinic, and you should fall in order again. So you get that one every 3rd round, I think. So,
Thank you.
okay.
Speaking of pharmacy, do we ever order more than once, do we ever do refills more than once a month? Do we refill let you have every 3rd, 3 refills?
90-day refill.
Do 90
We
day
do? We do
refills?
90 days? I see Dr. Montgomery nodding, yes, yes. I'm glad. That ought to be a huge time management issue for a lot of our citizens. I was told that there is a new act called the Lower Drug Cost Now Act. Are you all familiar with that yet? Expanding Medicare to include comprehensive dental coverage.
I'm not aware.
Okay, we're talking last week, so
Okay.
that's when I was told it happened, but maybe not. Okay, and,
Some things don't apply to us the same as they apply to the secular world because we're already in the federal system where we get things at a discounted rate and things come at us at a all-inclusive rate. So sometimes those types of things that are fee for service and don't really pertain to us at all. But I'll
Okay.
check into it.
On the MRIs, how long does it take to get an appointment now? Are things slowing down, or is it still as busy as what was projected?
I'll see if I have an answer on that.
It's very busy. They're doing their best to keep it operational throughout the day's schedule. And again, the challenge is just contacting patients to verify that they're going to keep their appointment. Yes, they're doing a great job keeping up with the referrals.
Wonderful.
Yes.
Wonderful, I'm glad to hear that. In the future, will we be, I know heart disease is so prevalent among Native Americans, will we be acquiring another cardiologist in the future?
Well, currently we work with the Heart Center and through CHP, so we don't have a cardiologist that is specifically employed by us. Whether or not we will move and look at other avenues is, time will tell. I don't know the answer to that yet.
Okay.
It really depends on demand and what we have as demand and what we have as services for that demand.
Okay, and then, again, the Alzheimer's advocate, if we could ever get one, that would be awesome. I was reading where dementia doubles every 5 years after 65, and by age 85, nearly 1 in 3 of us will have it. So, again, support groups for Alzheimer's, I think, would be
And we've asked
awesome.
our behavioral health to look at that and look at what resources we have available for that and what kind of support groups we can form. So we're looking into it.
Oh, good, I'm glad to hear that. Does anybody else have any questions? Any information you want to share with us, Dr. Jones? It's not in your report?
Shared enough, I think.
Okay. Well, listen, thank you so much, and you have a blessed Christmas.
Okay, thank you
Dr.
very much.
Jones.
Okay.
And Dr. Montgomery, too, back there. Okay, next up is Cherokee Home Health and Cherokee Nation Hospice. April. Hi, April. Happy holidays.
Merry Christmas.
The report is in here.
Okay, so I'm sure you guys have our report that we've submitted, so I'll just go over that and then answer any questions that you guys have at the end. So for our census and home health, as of 11/30, we had 229 patients. Native Americans served since September, 211. In our hospice department, we had a census of 23 as of 11/30. Native Americans served since September, we've had 29. Our outreach department has a census of 756. Moving on to our employees, we have 172 total employees, with 56 of those being full-time, with 116 being part-time. 103 of those are Native American, with 86 being Cherokee. And that is all I have.
Anybody have any questions for April? April, how many patients did you have to turn down this last month, approximately?
Oh gosh, I would say in November, just off the top of my head, I don't have anything. I would say probably less than 10 this month of November. So a lot of education been going on in the communities, and that helps.
Yeah. Ask. Councilor Shambaugh.
Why are those people turned down?
Typically no payer source, maybe a private insurance that we are not in network with, or they might not just meet our criteria for home care services.
Are your services ever income-based?
No.
No.
No, ours are not. No, Medicare, Medicaid, and private insurance.
Okay. Anybody else with any questions for April?
Good report.
That was a good report, April. Thank you so much.
Merry Christmas, everybody.
Merry Christmas.
Okay, and then from PACE, Thelma Pittman. I saw her smiling face back there earlier.
Merry Christmas.
Merry Christmas.
Well, wanted to report on our Christmas party that was last Friday. Our employees worked diligently for our participants. We served we have 185 participants right now, so we probably served around 250 people last Friday. We were able to purchase gifts for each one of our participants because of Tarot giving us their proceeds from the golf tournament. It was around $19,000 this year that they donated to us, and we were able to spend all that on our participants. We circulated wish lists, and all of our employees shopped for the participants, and then Tara was on hand to hand out the gifts. So it was a great party. And we also were able to be in the Tahlequah Parade. Our employees got together and did a float, and so they were able to participate in that also. So that's the fun stuff. Our financial audit was finished early. There were no findings verbally from that. I should have a draft report on that in January, I hope. We finished October with $163,000 gain to the bottom line. We had 180 participants, and 49% of those were Native, 48% were non-Native, and the other 3% were African American, Latino, and multicultural. We had 66 employees in October. 50, excuse me, let me make sure that I'm going to give you good numbers. It's in the report. I think 33 were non-Native American, and 58% were Cherokee citizens, 8% were tribal members of another tribe. That's just about it.
Wonderful. Any questions? Thelma, I have one.
Yes, ma'am.
You said there's 49% Native Americans. I was just curious, is that figure supposed to be 50% up?
No, since we receive federal dollars and no money from Cherokee Nation, then we have to just accept whoever applies, so.
I didn't know, thank you.
Yes, ma'am.
And thank you for the explanation in your report. It was really good. I appreciated that.
Thank you.
I learned a lot in it. I also wanted to ask you, do you all have any caregiver support groups?
We, at times, pull the caregivers in, and also we provide, I think, 14 days of respite care for each participant so the caregiver can have a break. So,
That's really good. I want to go on the record as saying that there's a caregiver help desk, and the phone number for anyone interested is 855-227-3640. Again, that's 855-227-3640. And then caregiveraction.org is their website for anyone who might need something like that. Thelma, are any of your people provided transportation?
oh yes, we have 15 vehicles that we utilize, and we pick them up in the morning, bring them to the center, take them home, and we take them to most of their doctor's appointments, unless one of the family members volunteers to take them.
Wonderful. Okay, Councilor
I just
Nofar?
got a question, because we have all these vehicles, there are PACE vehicles, right?
Yes, sir.
It's just kind of something I thought of once back, a few months ago. I know a lot of our elders like to participate in a lot of our community center events that go on. We have all of our nutrition sites that we have. Man, it would be really interesting to see if there's some way we could incorporate the transportation with our elders and getting them to our local community buildings. Be able to take them by there, maybe even for like the bingo nights. It doesn't have to be every day, but I know that's something that naturally our elders deal with as they get older is depression. I mean, it's just part of the nature of getting older is you lose loved ones, you lose your family members coming along, and getting out and amongst your community. It might just be something to look into to see if there's some way we could incorporate that. And
We have a social service department. We have a LCSW on staff, and they work with our participants. And we also have transportation. It's something I can mention to them.
yeah, that would be
Councilman.
great. Yeah,
Okay.
I'd really love to hear back from them.
We also have a presence, hopefully, at each council, at each event. If someone's having a community
Yes.
event, our marketing folks go there and have a presence there whenever possible.
Very good, very good. Any other questions for Thelma? Councilor Austin?
You've got it says in here that you cannot enroll anyone that's not living in their home. And that goes on to say, but if they move to nursing home
Yes.
But what constitutes their home? Is that the home they live in, a home that's a pretty broad word.
Right, and that's in the regulations, but it's where they may live with their children, they may live, it's their home at that time. They can't live in a nursing home at the time of enrollment, but
So
they can,
basically, if it's not a nursing home, it's their home.
yeah, pretty much, really. It's pretty broad term. And our marketing intake people are very acute and understand that and work with those things. So,
Thank you.
Okay, any other questions for Thelma? Thelma, excellent report. Thank you so much.
thank you, ma'am. Merry Christmas.
Okay. Is there any old business? Okay, new business. Counselor Duncan.
Yes, ma'am. I'd like to amend the agenda to include a resolution authorizing Cherokee Nation Health Services to donate a metal frame building to Marietta School in Adair County.
Second. We've had a motion made and seconded to donate the building in Marietta, the clinic building. All those in favor say aye.
I have a question. Why is this going through health?
It's a medical building. The building that has been donated, it's from Health Services.
Health and talk. Mr. Antelope can shed more light on that.
If I may, the reason we're asking you to consider this today, that Stillwell renovation of the Willem P. Mankiller Clinic has been contingent upon scheduling of the robotic system in pharmacy and getting that company in. We finally got our window for them to come in and do that and transition this out, which means now the demo and the other phases of construction can fall right behind that. And so we need to try and make allocation. So we don't want to just bulldoze those buildings and destroy them if they're salvageable. And so what we'd like to do is ask that you consider moving this forward to council tonight. That's why we're running this through health, is so that we can make this donation and let them come get that building and get that to them so we can get started with construction in first part of January with the demo of that portion of the building. Because it's physically in the way. And it wasn't, the demo of that building, the removal of it was not included in the scope of work for the construction project.
Well, when we're donating a piece of equipment from Natural Resources, it doesn't go through the Resource Committee or Community Service Committee. I don't, this is not the appropriate committee to bring this through.
It's just holding up the demolition, correct? And January, full council would be even that much more on renovating a health facility.
We have some other things that we're looking at, and I apologize for having it go this way, but this is so we can get that building.
Todd, you asked this to come through this committee because it was a Cherokee Nation Health Services donation, and that's why you all asked, and I agreed to let that happen. I realize it's not the appropriate committee, but they needed to rush this so that they can go ahead and progress with the construction of the new clinic and get it out of the way. Okay, anybody else have any questions?
It's like, just curiosity, what is Marietta School gonna intend to do with the building?
I can't remember if it was football equipment or if it was like lawn maintenance equipment.
Storage.
Just keep it up.
Storage.
Yeah.
All right, cool, perfect.
It's not well insulated or anything. It's just
Yeah.
a simple little metal building. We'd rather a community or school use it. instead of
Absolutely.
Making it go to waste.
Okay, anybody else with any comments? Okay, so the motion's been made and seconded. All those in favor say aye.
Aye.
All those opposed, same sign.
I'm opposed.
Okay, motion passes.
Now you need to.
We'll be bringing that to tribal council this evening.
No, we have to vote on it.
That's
Okay.
not on the agenda. Now you have to vote to approve the resolution and send it to council.
Okay, then we'll do a vote to approve the resolution to take to tribal council tonight. All those in favor say aye.
Aye.
All opposed, same sign.
I'm also opposed.
Okay. Okay, any other new business? Any announcements? The next meeting is tentatively scheduled for Monday, January the 13th at 1 p.m. Thank you all so much. Meeting adjourned.
10 minutes.